Hey guys, our guest today founded Harmony Health Medical to provide a new approach to healthcare by combining both traditional and alternative options to help patients in chronic illnesses improve their long-term health. Having studied and worked as a pediatric gastroenterologist, she is uniquely able to achieve better overall health for children and adults using new approaches and personalized therapies. Welcome to the show, Dr. Zeb Memon.
Hi, thank you so much for having me.
I'm so excited for this. There's so much that we're going to tackle. We have about 45 minutes to do so. I have some questions prepared for you, but what I'd like to do before we dive in to some of the deeper medical conversations that I'd like to have with you and kind of open the door. We're going to talk a little bit about traditional versus non-traditional medicine, things that you're an expert on. Before we do that, pretty cool. So I know you were born and raised in Toronto.
Yes.
So I'm in Buffalo, if you couldn't tell with all the Buffalo love behind me on the wall. And many of my listeners know I'm from Buffalo in Western New York. But you're just a neighbor to the north where you were born and raised. And now you're also in Western New York. And I know you've embraced that. What brought you here? I know you went to school at UB. Is that what originally brought you here, or were you here first?
I was here first. My husband is born and raised Buffalonian. So I've been in Buffalo for over 15 years. So Buffalo's home to me now. Yes, my original home was in Toronto, but I've been here for a really long time. So Western New York is definitely home to me.
Now, as we record this, we're still in the middle of a pandemic, and I think there's still the travel ban. Do you get up to Toronto quite a bit, though, to visit family, or not so much anymore?
Not so much, no. Yeah. There's just been so many restrictions. My parents are there. They all are elderly, so I'm careful. And I think, we have to be careful. So I've seen them once during this pandemic, and we're just sort of sitting tight right now. We've been doing a lot of Zoom calls and FaceTime, and that's how we're getting by.
Hey, speaking of that, Zoom and FaceTime and technology, as I just mentioned, we're in the middle of the pandemic, but I know you were one of the first practices, at least that I knew of, that was doing telemedicine. So tell our audience what telemedicine is and how you kind of pivoted, and that word is getting overused as well during the pandemic, but how you embrace technology and use it as a way to get ahead during this time.
Sure. So, there are actually other practices that are doing this as well. I was originally, when the pandemic started, I was, getting my office sort of renovated and fixed up to just make it prettier. And then the pandemic hit and we couldn't get anything done. But then I thought, this is probably something that we could do. We could still continue to do, keep people safe in their homes, because even now, going to the doctor's office is a risk, and people don't go unless it's an absolute dire emergency. So this way, with the comfort of their own home, we can sit, as you and I are speaking right now, seeing each other, and I can get a full comprehensive history. I can, review all medical records that are relevant, and give my recommendations. So that's, I think is obviously not as good because I don't get the hands-on. I can't. The patients, but I think it's with technology now, there's so much that we can't do.
You still have the personal touch, though. You get to see someone, feel their emotion, get to understand them. And that's so important. I will say this, and something we're going to talk about in a minute is gut health. And I finally, after many years of having issues with my gut health, I had a 2-hour conversation with my dietitian via Zoom. And it was just a couple months ago, or it's actually the beginning of the year. So a few weeks ago now. And for 2 hours, she just asked me great questions, detailed. And I felt like I was in, just as if I was sitting there in person with her taking notes. And then she was able to send me digital notes, and we operated as cleanly, and you save on drive time too.
Absolutely.
And I think it's probably easier for like the waiting room situation. Like, okay, my time with you ends at 1:30. Boom. I'm bringing the next person in. There's no wait to get them into the room and everything like that. So you're probably operating at a quicker pace as well.
Exactly.
Most people have embraced it. Do you feel that there is some pushback on that, or?
I think this is sort of the new norm now. School is like this. Doctors' offices, visits are like this. As you said, the nutritionists, meetings, work, it's sort of all revolving around this now. I think in the beginning, it was something that was really difficult for everyone to get used to, providers, patients, receiving, giving, and everything. But now I think this has sort of become the new normal.
Yeah, I agree. So talking about medicine, obviously you're a doctor and this is your field of expertise. We talked a little bit about this off camera. I'd love you to bring this onto the show. Tell us about how it all began. So you're a little girl at some point and you feel you want to go into this field. Talk about, because my show, the purpose of me doing Mic'd Up to bring you up to speed on this is the mission is to inspire my audience to be brave and bold in pursuit of their dreams. So I'm wondering, and obviously you're brave and bold in getting into this field. When did that spark happen for you?
I can't remember it ever. I don't remember there being a time where I didn't know what to do. And then I said, okay, I'll be a doctor. I felt like this was something that I always wanted to do. And I think it stemmed from the desire to help, you know, and that was just always there. That desire in me was there. But then academically, I was sort of inclined to the sciences more. You know, I liked the biology, physics, chemistry. I just took more interest in that. And as I went through all of my schooling and my training, I couldn't see myself doing anything else.
Yeah. It sounds to me, talking to you right now in our previous conversation, that you are connected to your purpose, which is so important for people to really follow their heart, get connected to their purpose. It's their thing, right? And really embrace it. And with you, it's kind of the alternative medicine, kind of the more modern medicine feel, and making sure you're helping people out. I actually wrote that down and circled it over here because that's what your purpose is. So elaborate a little bit on that. Like, you wake up every day and you love what you do. And what do you feel is your definitive purpose?
Well, so I can tell you this. When I was training in conventional medicine, again, like I said, I went into for the purpose of helping people, and I did that, and I got that, and I felt that gratification until I came to a point where there were some patients that I couldn't do more than than I was trained to do, and they needed more help. And that was just going against my fundamental beliefs, why I decided to go into this field. In pediatric gastroenterology, there were a lot of, and adult gastroenterology, there were a lot of patients who were labeled as irritable bowel, functional abdominal pain, functional dyspepsia, fatty liver, where there's not a magic pill. They needed, their hand held and more guidance. And it was a longer term plan, which quite frankly, in conventional medicine, we're not really trained to do, and we don't have the time to do, because it's just the way that the model is set up. And I just didn't feel happy anymore. I didn't feel like this is something that I'm helping my patients with.
Kind of felt like you're more in the job and less in the career that you were born to be doing. Yeah. I
didn't want to live by just, I have to see this many patients in an hour. I have to see this many patients in a day. It was like conveyor belt medicine. And that wasn't something why I went into this. So, I started looking into other options, and I ended up training extra in functional medicine so that I could help specifically those patients. And that's how I ended up here.
Can you help us define, so myself, who I'm not well versed in a lot of the terms here medically, but sure, break it down real simple. So there's traditional, there's non-traditional, which is also known as alternative, and then there's functional. Can you kind of give us the three buckets?
Yeah, so it's really confusing because it's not really well laid out. And basically what it is traditional or conventional medicine is, the doctor that you go to, you get 20 minutes with them, or you go to the emergency room, or you get, your surgery done. And there is a place for that. You do need that kind of medicine. If you need antibiotics, you need surgery, you break your arm, there's a role for that. There's an importance of that. But then there's functional medicine, and functional medicine is basically how do we get our bodies to function normally, optimally, physiologically, the way it's meant to, so that we don't get sick with all of, the toxins and the exposures that we're getting in the environment and in our diet and things like that. So it's basically how to get your body functioning optimally.
So let me make sure I understand this and tell me if I misunderstood. So kind of traditional medicine is how you can operate with the assistance of medicine, and that can kind of be one thing. Where functional is more, how can we get you functioning at an optimal level and wean off those medicines, and what healthy, natural foods and supplements are there that you can take to be at the optimal health?
Exactly. Or also
that some people do need medicine, like, my brother has MS, and I know people who require their medicine. Without it, they're going to be in really rough shape, and you know what that look like. But aside from like terminal situations or something that's you absolutely need this, we're talking about just someone who's relying on the average pill just to kind of get through when they could find more of a holistic way to do it. Am I understanding right?
Exactly.
Podcasting is a great way to engage with your audience and stay consistently relevant. The only problem is you don't have the time or desire to produce your own show. You simply want it done for you, and that's where Social Chameleon comes in. All you need to do is press record and upload the files. We'll handle the rest. From planning, production, post-production, distribution, and digital marketing, we have you covered. We realize that times are tough and funds are tight, and Social Chameleon believes in building supportive business relationships. By clicking on the link in this promo, we'll provide you 7 free podcasting tips to get started, as well as a free 30-minute online consultation. This is the perfect opportunity for entrepreneurs, keynote speakers, industry experts, influencers, and anybody who has a personal brand. With Social Chameleon, we help you build a brand that is out of this world. We're ready and waiting, so what are you waiting for? Click on the link to get started today.
Yeah. So what are some, let's talk about this. We'll go back to the gut health part because I mentioned that at the kind of the top of the show. Met with a dietitian. She has turned my world upside down. I'm doing an elimination diet right now, right? So for 3 weeks, just taking away, eating very basic, logging everything. Every time I eat, the whole deal. And she evaluated it at our first meeting, and I'm doing really well. I feel better than I ever have. I'm losing weight, about 2 pounds a week on average.
For you.
And all I did was change my diet. The next thing I'm going to do is add an exercise.
Yeah.
My point is, I'm someone who really, my family and friends knew me as the guy that would sit down for dinner, and I was the first one to leave because I had to run to the bathroom. We'd be watching the game. I had to run. Like sometimes, every commercial break, where is he going this time? Back and forth. And so I knew something I was eating was really bothering me.
Mm-hmm.
And I had another guest. I'm going to give a shout out to Jeffrey Berger, who's also someone who studies gut health and optimum health. And he talked about how, and I mentioned, like, I've heard that the gut is referred to as the second brain. He said some people call it the first brain. Mm-hmm. And I love your version and interpretation of that. Tell us how important the gut really is.
It's so important. And the funny thing is that this is something that we've been, hearing from, Chinese medicine and Eastern medicine for many, many, many years. But now we're seeing it more and more in Western medicine where, evidence is emerging that there is so much importance to it needs to be given to your microbiome, which is basically all the bacteria that live in your gut, for your entire body to be functioning well. It's not just your gut to function well. It's even, studies are showing that people with migraines have a changed, an altered environment in their bacteria and the natural bacteria in their gut. So depression, mental health, so many different things that you would never think are related to your gut actually are, studies are showing that they are.
Mm-hmm. Does it go both ways though? Like if your gut has some issues, then it can cause you to have depression, or does depression have kind of a chemical situation that happens in the gut? Does that make sense?
Yeah, I think it's actually, I think it's starting more in the gut. If you look at just like leaky gut, for example, we do want some sort of passage in our gut for nutrients to come in and whatnot. But when we're talking about leaky gut, we're talking about too much of passage so that you're leaking out nutrients as well, and an inflamed gut, if you will. And that, in that sense, you're causing a lot more pathology in your body, where you can then lead to, fatty liver, headaches, autoimmune diseases, fatigue, joint pain. So much of this is being linked to your gut.
One of the things I felt personally was inflammation. I was like, I didn't feel like my gut was all fat, right? I just felt like a lot of times I looked a little bit better than other times. And I knew that certain foods would make me feel like I just had this huge inflamed belly.
Right.
And then when I had the elimination diet, I'm like, wow, it's basically almost all gone. I told her about 95%. So I'm doing one more week of the elimination. So inflammation is a huge part of it. I want to define leaky gut and talk about fatty liver as well, because those are things I think a lot of people they misinterpret what they are. At least I did.
Yeah.
Leaky gut. So you just explain it like nutrients are coming through, and a leaky gut just lets the nutrients right out, and it doesn't go back into your system.
Right. And it depends on the degree of damage. So celiac disease, for example, it's an autoimmune disease. Antibodies are sort of attacking. There's basically an inflammatory reaction that's happening that's damaging the structure of the absorptive surface of your gut. So, you can have things like anemia, or you're just not absorbing all of your vitamins and nutrients. And so what's happening is you're not absorbing, but then if there's so much damage to your gut wall, you're also leaking out.
Yeah.
And that's, that can be seen when that inflammation sort of goes all over your body. You can see that in so many different, forms.
Right. So it's getting into areas it's not supposed to, because your gut could be holding it in or absorbing it in some way. And then fatty liver is something, when you hear fatty, you think it's got to be someone who's obese or way overweight to have a fatty liver, but that's not always the case either.
It's not always the case. Yeah. There is some degree of, being overweight, but it's not always the case. And it's not like, if somebody is more overweight, their liver is going to be fattier than somebody else's who's not as overweight.
You could be a little bit, because I got some blood work done once for a life insurance policy, and everything checked out. And they mentioned that I had fatty liver. And I was like, maybe a little bit overweight at the time, but I was like, what are you talking about? So then they did the sonogram deal.
Yeah.
And said, I forget what levels it is. AHT, is it? Or ALT? Something like that?
Yes, ALT. Mm-hmm.
ALT levels were a little bit raised. And then basically I went to some clean eating after that and was able to reverse it. I know fatty liver is reversible, but cirrhosis, is that what it is?
Yeah, that's cirrhosis. So that's like scarring.
That's scarring and not reversible. Is that true?
The interesting thing in if it's fatty liver, if it's because of fatty liver, you actually can reverse all of the damage on your liver. Unfortunately, fatty liver, if left completely untreated, is becoming the lead cause of liver transplant in young adults, which is really sad because, like you said, with just some lifestyle changes, you were able to improve, those numbers and ultimately improve your liver and your health. But there's a lot of people who don't get that support and they don't get that education. And that's really my biggest, driving force, is that these people need that support. And sometimes it's diet. Well, it's always diet and lifestyle, but sometimes there's a little bit more you can do. There are some natural elements that you can add that can enhance detoxification in your liver, which would, is great for these type of patients. But just to tell them, we did your blood work, we did your sonogram, we did a liver biopsy, and now there's nothing else we can do. So you have to lose weight, and we'll see you in 6 months to check your levels again. It wasn't helping. Yeah.
I love that you're tied to someone's overall health and not just giving them take some medicine, go to your local pharmacy and this, that. It's like you're actually working with them on correcting it. Because again, the thing with health is it's not a 5-minute correction. We're talking about a lifestyle change. We don't want to just fix it for 2 weeks and then the next time you come in and check the box, and then the 6 years you have a fatty liver again. We want, you're talking about, and the reason I wanted you on the show is to help people do, what can they learn? And one of the things I circled on here was some dietary suggestions you have for a healthy gut that would take care of, we talk leaky gut, fatty liver, but really just overall gut health. There could be someone listening now that's in pretty good shape. They work out, they're eating pretty good, but they may just be interested in like knowing that they're doing the right thing. We could all Google it, but hearing from a professional who says like, here's some bullet point, start here. What would you tell somebody?
So, I can give some general points. The thing is that with something like this, especially in functional medicine, it is so customized. And that's what I really like about doing it like this, is that it's not cookie cutter. And that's what I felt was in conventional medicine. It was so cookie cutter that we would say, do this diet for everybody, or, don't take this or take this. For example, somebody with irritable bowel syndrome, if they were to take fiber, they could initially actually worsen their symptoms. But of course, you're going to think fiber is great. Everybody should take fiber, right?
That's what you hear. It's almost like milk helps you have strong bones. And it's just such a blanket statement without really understanding what every specific person needs to be evaluated in a
Exactly. Now, of course, I'm going to say
in the
Right.
micro, right? So
Exactly.
that's
And so
great.
of course I'm going to say, get your sleep, log what you eat, drink your water, take your vitamins. But, more specific, I really want to know. And I ask, it's like a 15-page questionnaire where I really get into the nitty and gritty. I ask about your sleep pattern and just your diet, your complete head to toe symptoms, because again, it could be coming from your gut and you don't realize it.
Mm-hmm.
And you could have a symptom that you lived with for so long that you think that that's your normal.
Mm-hmm.
So it's sometimes it takes somebody else to sort of ask you and tell you that's not normal for you to realize that you need to make a change.
Yeah. And when we originally were going to record this episode months ago, and then I ended up getting pushed back for some personal reasons on my world. And I'm glad that it did, because now I can actually talk about a lot of the personal things that we're literally talking about, gut health. I will tell you, I'm someone who thought I was screwed for the rest of my life and that I was never going to be able to fix this. Maybe I can mask it a little bit with eating some healthy foods, but I never thought like I could go 12 hours and be productive at work without needing to run back and forth to the bathroom. Mm-hmm. And I know that's a personal thing to say, and I'm being vulnerable right now, but I want people to know that you really can turn it around, and our bodies are a machine. And when you feed it the right things, and it's just like you want something to operate at optimal health. If it's your computer, you don't want your computer to have viruses and bogged down with junk. Your car, you don't put junk into it. You put the gasoline that makes it run. Our bodies need these natural fruits, vegetables, and a well-balanced diet, along with sleep and everything else, which I need to get better at myself with a strong routine. But really, like anything in life, we talk about business, we talk about our personal health, the daily disciplines that are going to get you to where you need to go. And it's the little things collectively that I personally feel are going to get you there. And I just wanted to kind of get up on my pedestal for a second and say, look, guys, I'm doing it. If I can do it, I think I need to get things positioned to me, simple, stupid, so I can literally follow it and not be overwhelmed with it.
Absolutely.
And it is pretty simple to follow.
Absolutely. And I do want to add in there that, like you said, like human bodies are machines, they're also very resilient. So just because something didn't work for you in the past doesn't mean you have to give up. I think changing your ways, finding new ways, having an open mind is so important in the process of healing from both the patient and the provider. And that's what I'm there for. I'm there to, see them through that journey. So that, it's going to be a long road, but look, they were suffering for this long. It's not going to be an overnight fix, but I'm going to be there for them. I'm going to find an alternative, whether it's in conventional medicine, whether it's in functional medicine. And I'm thankful that I have the opportunity to wear both hats. So I can pick up, red flags from the conventional medicine standpoint, but I can also add in some pearls from functional medicine, alternative medicine, integrate, and sort of make an integrative picture of the whole thing.
I really love you elaborating on all this. I'm so happy to have you on. And I meant to do this a lot earlier, but guys, if you want to check out Zeb, her website is harmonyhealthmed.com. Again, harmonyhealthmed, med.com. And her Instagram and Facebook is simple to remember. It's at Harmony Health Med. And you can follow her on LinkedIn at Zeb Memon, MD. Anything else you wanted to add there as ways for people to find you? Or did I hit it?
I think you pretty much covered everything. Yeah, I've been getting a lot of messages on Messenger as well. So that's another way that they can reach out to me. But
on Facebook?
Yes.
Okay, cool.
Yes. And I just want to say thank you so much. I think you're doing such a great service just to bring awareness, especially at a time like this when people are they don't know and they're stuck in their homes. And I think this is a great avenue for people to just get to know what's out there.
Yeah, I love having a unique mix of guests on and different topics, and I try to mix it up. And we've had some health and fitness on. We've had entrepreneurial startup stories. We've had athletes on. So it's just been a great mix, and you're definitely bringing it today. So with the last few questions and about the last 20 minutes here, I want to talk more about yourself and a little bit of your story and kind of pick your brain a little bit. But what I'd be really interested in is if you can share, take a second to think about it if you need to, but one of your favorite highlights working with a client, something where you saw dramatic progress and just like,
Sure.
it just made you smile ear to ear.
I don't have to think about it because it's the first story that comes to mind. I was seeing a patient who was labeled as functional abdominal pain. And she was actually not feeling any better with the recommendations that were given, because frankly, there aren't a lot of recommendations that are given, as I mentioned before. And so she came to me for a second opinion. This is when I was in the conventional medicine world, and said, I'm just not feeling her. She came with her mom, teenager. She's missing a lot of school, terrible stomach aches, just was not satisfied with the advice that was given to her. And I sort of went through the whole laundry list of tests as I was trained to do. Everything had been done. And I even did another endoscopy to think maybe something was missed. I did an endoscopy, colonoscopy, and everything looked okay. But I did take a little extra time to do a little bit more. And I tested her digestive enzymes in her small intestine. And it turned out that she had a deficiency of the enzyme sucrase, which means that she wasn't able to digest anything containing sucrose, which is in sugar, but it's in a lot of other products, not just table sugar. Right? Yeah. So, I got that back. Now, a lot of people, took it with a grain of salt. They said, well, when you get that sample, it could be a false, result, and it could be this, it could be that. And I confirmed it with a breath test, and lo and behold, it was a true result. She really was sucrase deficient. We started her on, you've probably heard of the tablet Lactaid, which helps you digest lactose. We got her on Sucrade, but we also did thorough nutritional counseling on how to avoid sucrose in her diet. So of course she had the pills in case, there was as a backup in case she needed it, but she was thoroughly educated on how to avoid that sucrose. And she came back to me a few months later, back in school, brand new person, grinning ear to ear. And that's the first time I saw her smiling because she was so miserable, the poor thing. Mm-hmm. And that's when I knew. I said, I can't sit for 20 minutes with a patient and do just the regular tests and say, sorry, I have nothing else for you. Because I got to the bottom of it. It took me some time. I got to the bottom of it, and she was a changed person. And that's when I knew that I had to do more.
Oh man, I love it. Right there. Boom. That's your purpose, right? And I can see it. Yeah. You're glowing right now. Tell us more about you as well. What are some of the things that while you're maybe taking a half a day or a day off, I know you have your husband and your daughter, right?
Yes.
Family.
Yes.
I don't want to answer that for you. I just wanted to acknowledge and give them a shout out. But when you're not practicing, what do you like to do?
I love cooking. And my daughter has been cooking and baking with me since she was 3. She's now 8. So she's always in the kitchen with me. We love to just prepare meals at home. And I think that's something that I tell my patients about also. It's not difficult. You don't have to be a gourmet chef, just simple things, clean, simple things. I love to do that. We're thinking of growing our own vegetables this year as well. So we're getting into that. But yeah, I just love to do that. I love reading, but really I'm happiest when I'm in the kitchen.
Yeah, I love that. I'll have to come over after COVID. Maybe we can have
absolutely.
I'll bring your favorite glass of wine, right? So, who's your biggest influence, would you say? And that can be anything personal. It could be business. And then tell me about some of the favorite books or podcasts you like to listen to for your inspiration. So
I think I want to start with my parents. They were, they lived a really, they lived a life where they just wanted to not hurt anybody's feelings and just, look out for everyone around them. And I think that's where I got that, passion for helping people in any way, shape, or form. And I felt that maybe being a doctor was the best way to do that. But even now, I like to do things that are not medicine related where I can practice that. And I think, and I got that from them. And I really think that helps me to be a parent as well, because you really have to model the behavior you want to see in your children. And so I saw that from them from the beginning. My husband, who is actually a pediatric neurologist, is such a wonderful person. His patients love him, and he's also a huge inspiration to me.
Yeah, that's awesome. Great shout out there. And then when you're cruising around driving, do you tend to listen to podcasts or audio books at all? What are some of the things you're putting into your think tank?
So life is so busy, right? I mean, I would love to just sit back and listen to, an audiobook, and it's on my list of things to do because I recently discovered a public library app that I want to do that with. But to be honest, I feel like we have to take out time for family is the most important to me. And when I'm driving, honestly, I really am. I'm trying to call family. I'm trying to, catch up on things like that so that
I get it. Yeah.
So that I'm not saying that I was too busy.
Yeah.
And that's honestly what I do spend my time. I'm a huge multitasker. I think, in residency where we are trained to do that. And that just sort of carried that with me. So I'm constantly just, calling or things like that.
It's funny you say that, because one of the benefits of this pandemic, and it's hard for me to say that because obviously it's a devastating time, but I mean, one of the like silver lining deals is that drive time, cut down on the extra things in the day that were just an extra necessity, like driving around.
Yeah.
But at the same time, on the flip, I do also do what you do, multitask, call people. The other day, I finally called my friend back from a couple days prior because I knew I was driving to go get my daughter. And I was like, I'll call him in the 20 minutes right there. That's my window to catch up.
Right. Exactly.
But so I use it as like catch up time. I call it windshield time.
Yeah.
And but at the same time, I also use that if I don't have a call in that moment to listen to podcasts and things like that too. It's a great way for, hopefully people are listening to us right now and they're hands free and they're safe while they're doing it. This is not meant to be a curveball by any means, but really just to kind of get a big picture view on Zeb. So if you can be known for one thing, what would it be and why?
Just that I want to be able to say that I made a difference, whether it was in one person, whether it was in the community, even if it was just in my own home with my family. I just want to know that I made a difference. And I don't think any difference is too small.
Yeah.
I don't think that effect that you would have on somebody is too small.
Yeah, I love that, because a lot of times you want to give this answer. I say you, meaning my guest, myself, just anyone listening, wants to give this larger than life answer. But really, it's like, how about be the greatest version of yourself for your daughter? And I have she's going to be 6 in a couple of weeks, 6-year-old daughter. Like, what about that? Let's start there. And it isn't too small. That's the biggest thing you can say is take care of your family first, right?
Exactly.
And then from there, then it's your community. Then you reach out. It's your neighbors to the left and see on your street. And then it's your neighborhood, and it's your Instagram followers. And then it's the stage that you speak on and talk to 100,000 people, whatever it might be. I love that answer. And it's, everyone's answer. There's no right or wrong answer. That's why I think it's a nice question, because it allows you to really kind of show who you are, showcase who you are, and what's most important to you. If you remember at the top of the show, I mentioned the mission, why I'm doing this, is to inspire people to be brave and bold in pursuit of their dreams. If you can give our audience one message to do that, what would you tell them?
If I could just say that it's never too late to change. Whether that's, if you don't have a medical condition and you just want to be healthier, you just want to improve, then I'm speaking to you. If you have a medical condition where you have tried everything and you feel like nothing has worked, then I'm speaking to you. So any change you want to make in life, embrace it. It's never too late. Whether you're young or old, full of energy, tired, there's always a way. Yeah,
beautiful. It's so true. I just had a post about that this week, about change and embracing it instead of fighting it and kind of pushing it, because you got to embrace it. It's like the caterpillar embracing change, because if they were afraid of change or didn't want it, if they were told there's going to be this big change, we're talking huge change, it's like life-altering change, they may say, if you can say yes or no to it, and we're talking about a caterpillar right now, but this is kind of a hyperbole, right? Or symbolic of us. If someone came to us and said, there's a major change, it's going to change your appearance, it's going to change the way you operate, we may say no because we're scared. But what if it allows us to fly, and before we had to crawl? That would be embrace it, right? You're going to be beautiful in color. You were just green before and brown. Now you got these beautiful wings and a beautiful color, and you can go and explore the world. But I think a lot of caterpillars, or a lot of people who were given this offer, would you love to change? A lot of people might say, I don't know, it's kind of scary. Unless they knew what it was. So I love that embrace the change, because beautiful things can come. Talking about silver linings in the pandemic, it's a horrible situation. Guess what? It was essentially dropped on our laps. Nobody woke up one day and decided, as Americans, speaking for us here on our soil, we didn't wake up and say we want to have this pandemic, that over hundreds of thousands of people have died in our country. But at the same time, and I lost 2 family members to COVID and have friends that have lost many. But all I continue to think about is what can I do and how can I see it somehow in a positive way? It's allowed me to operate different in business, yourself with telemedicine. I've connected with more people on LinkedIn and made more closer connections, even being distant from people because of technology. So it's embracing the change and trying to get the most out of it. And that is something I see you've done. That's why you're here today. And I'm just speaking to my audience right now. What can you take from the last 12 months that was kind of a gut punch? There's gut coming up again. But like the, what's the word I'm looking for? Metaphoric gut punch, right? And how can you be better for the turmoil? Let your test be your testimonies, right? And everything happens for you, not to you. When you think of the world that way, I think you start to solve for it a little bit differently. Last couple things here. Anything else you'd like to share before we sign off?
No, I think the biggest, the biggest message that I want to give is, again, just don't give up. There's always help. There's always a second chance. There's always room for change, and you are your biggest advocate. If you don't fight for yourself, then nobody will.
Yeah.
And my role is, my hope is that I can help you start that journey and, just to better health, to a better you.
Yeah, I'm writing that down. If you don't fight for yourself, nobody else will.
Absolutely.
That reminds me of something that I reflected on before. It's, when you're thinking about being genuine, being yourself, it's be yourself. Everyone else take it. So it's about being unique, but it's also like, if you're not fighting for yourself, who's going to come in your corner, come and get you out of that situation? We can lean on our friends, our family, and our community to help pick us up when we're down.
Yep.
But at the end of the day, who's the one that has to go and fight? And we could be talking about literally a boxer going to fight. Hey, man, no one's in there swinging. It's your 2 arms against the other guy. Right. And so you gotta fight your own battle every single day. And then I would just suggest to people, if they're not sure what they're fighting for, get laser focused and clear on their purpose, which and I know what our purposes are every day. And that's what allows us to go full swing. Like we're just, we're not laying back. And I love that. All right. So tell us this. I always say, be great and be grateful. Love to end every show with that message and every email with that message. Be great and be grateful. What are 3 things that you're most grateful for?
I am grateful for, my family, of course, my parents, my husband, my daughter, my family. I'm grateful that I had this opportunity to think outside the box. This was very difficult. This was an uphill, battle for me. It was very easy for me to just, fit in like a jigsaw puzzle, like the rest of, my colleagues, and do what I was trained to do, and just say, oh, well, when patients were not, given the treatment that they needed. So I'm grateful that I had this opportunity, that I had the courage to do this and the support to do this. Mm-hmm. And I'm very grateful to be, in a place. I mean, I'm in Buffalo, I'm Western New York. To be in a place where I think we've noticed this more with the pandemic, that people do really care about each other. Mm-hmm. And I'm just so grateful to be among, such caring, thoughtful people.
Yeah, I love that. And here's the thing. I want to make sure we hit on this last point before we sign off, is talk about being brave and bold, right? In pursuit of their dreams. Well, you already were living what many people would dream to be, which is a professional doctor at a high level, but you were in more traditional medicine and doing things kind of like how many people you can see in an hour, almost like how at Tim Hortons, they try to get everyone in 30 seconds or less, they have to get their coffee and donut. And if not, it starts to blink and everything else. So you felt yourself more of a natural fit into the alternative medicine route. And So did you feel that by making that transition that you had, was there something at stake there? Like, were you afraid that you would be taken as seriously maybe? I don't want to speak for you. What was at stake when you said, you know what, I'm here and doing this, but it's not really what I want to be doing anymore?
So essentially what I was doing was, number one, I was starting up my own practice. Even if that was in conventional medicine, that's terrifying because now you're a business, now you're in business. So that in and of itself was scary.
So you were at someone else's practice and then started your own.
Yeah. So I was working, at the Children's Hospital. And I even went, out of state, and I was working at another children's hospital for a couple of years, and I came back to Buffalo because Buffalo was home. And it was very easy for me to just join the Children's Hospital again and do what I was doing and trained to do, status quo. But so just opening a practice on your own is terrifying. So that was the first thing. And the second thing was starting this, going down this path of something that I wasn't primarily trained to do, but I was just sort of making this new niche for myself.
Yeah.
So something completely novel, and also not having a lot of people in town that do this, that could guide me through it. So there were a lot of factors that I was scared of.
The unknown. There was a lot of unknowns in that.
A lot of unknowns. Yeah. A lot of unknowns. And again, like how you said, coming back to what you said before, that change is scary. Mm-hmm. But it can be a wonderful thing if you just jump in. Yeah.
I think you're meant to be doing what you're doing right now. And it's an honor to call you a friend and have you on mic'd up right now and deliver this to our audience. Guys, again, Zeb Memon, you can check out her company and her website at harmonyhealthmed.com. On social, it's at Harmony Health Med on Instagram and Facebook. And I had an awesome time today. I learned so much. I got notes here. The whole page is filled with notes, and I'm looking forward to following up with you and keeping an eye on your growth, because I know where you're at right now is a great place, but I also know that you're not even close to where you're going, because you're looking to really change the world. You're a change maker, and I appreciate you doing what you do.
Thank you so much. And likewise, I think you're also making huge changes, just bringing awareness to everybody. You're doing a huge, great service. So it's really been a pleasure to, get to know you, to speak to you. And I look forward to seeing more of your work as well.
Thank you so much. Appreciate your time today.
Thank you.
I love you guys, and thank you so much for tuning in. Check out more show notes and information on each episode at mikeduppodcast.com. MIKED uppodcast.com. We're powered by Social Chameleon. You guys know what to do. Be great and be grateful.